Learn about the skin cancer. Skin cancer is a type of cancer that develops in the cells of the skin. There are different types of skin cancer, including melanoma, basal cell carcinoma, and squamous cell carcinoma. The symptoms of skin cancer can vary depending on the type, but some common signs to look out for include: 1. A new mole or growth on the skin. 2. A change in the size, shape, or color of an existing mole or growth. 3. A sore that doesn't heal or bleeds easily. 4. A lump or bump on the skin that feels rough or scaly. 5. Itching, tenderness, or pain in an area of the skin. If you notice any of these symptoms, it's important to see a dermatologist or healthcare provider for evaluation. They may perform a skin exam or biopsy to check for cancer. Improvement methods for skin cancer include reducing risk factors, such as protecting the skin from the sun's harmful ultraviolet, UV, rays, avoiding tanning beds, and wearing protective clothing like hats and long-sleeved shirts. Regular skin exams can also help detect skin cancer early, when it is most treatable. The treatment for skin cancer depends on the type and stage of the cancer, as well as other individual factors. Some common treatment options include: 1. Surgery to remove the tumor, which may involve removing a small area of skin, excision, or using a technique called Mohs surgery to remove the cancer layer by layer. 2. Radiation therapy to kill cancer cells and reduce the risk of recurrence. 3. Topical medications, such as imiquimod or 5-fluorouracil, which are applied to the skin to kill cancer cells. 4. Immunotherapy, which uses drugs to help the body's immune system better recognize and attack cancer cells. For melanoma, a more aggressive form of skin cancer, treatment may also involve additional testing to determine the extent of the cancer and whether it has spread to other parts of the body. Additional treatment options may include targeted therapy or chemotherapy. In addition to these treatments, many people with skin cancer benefit from supportive care like counseling or physical therapy. Working closely with a healthcare team can help ensure that people receive the most effective treatment and support for their individual needs. Learn about the bladder cancer. Bladder cancer is a type of cancer that begins in the cells of the bladder. The symptoms of bladder cancer can vary depending on the stage of the disease, but some common signs and symptoms include: 1. Blood in the urine, hematuria. 2. Pain or discomfort during urination. 3. Frequent urination or an urgent need to urinate. 4. Pain in the lower back or abdomen. 5. Weight loss or loss of appetite. 6. Fatigue or weakness. If you experience any of these symptoms, it's important to see a healthcare provider for evaluation. They may perform a physical exam, order imaging tests like a CT scan or ultrasound, or perform a cystoscopy to check for cancer. Improvement methods for bladder cancer include reducing risk factors, such as not smoking, avoiding exposure to certain chemicals and toxins, and drinking plenty of fluids. Regular screening for bladder cancer can also help detect the disease early, when it is most treatable. The treatment for bladder cancer depends on the type and stage of the cancer, as well as other individual factors. Some common treatment options include: 1. Surgery to remove the tumor or the entire bladder, cystectomy. 2. Radiation therapy to kill cancer cells and reduce the risk of recurrence. 3. Chemotherapy, which uses drugs to kill cancer cells throughout the body. 4. Immunotherapy, which uses drugs to help the body's immune system better recognize and attack cancer cells. For early-stage bladder cancer, treatment may involve removing the tumor using a technique called transurethral resection of bladder tumor, TURBT. For more advanced bladder cancer, treatment may involve a combination of surgery, radiation therapy, chemotherapy, or immunotherapy. In addition to these treatments, many people with bladder cancer benefit from supportive care like counseling, physical therapy, or nutritional support. Working closely with a healthcare team can help ensure that people receive the most effective treatment and support for their individual needs.